Since we are virtual, I'm going to go ahead and share my screen throughout. So we may have to do some scrolling up and down for the various providers, depending on if we go in order or not, but it should be on the screen for everyone to see.
Marissa or Jeff, just tell me when you feel like we've waited enough time to get started. I'll start whenever you're ready.
I just let Marty in, so we can probably
I think we're good to go. Our first two presenters should be here, I think.
Yeah, and I'm happy to contact LHA.
Okay.
Marissa, I just sent them the invite again.
Okay, so welcome everyone. We are here for the Program Performance and Evaluation Committee for the February 19th meeting. Thank you for accommodating the change of location to our virtual setup here, considering the weather. Our first item on our agenda is our introduction. So I'll just go down the list, and if you can unmute, go ahead and introduce yourself. So I'm Liz Sheehan, and I am the chair of this committee. I'm also a council member and a member of the HPI board. I will just call people's names based on the list I have in the participants. So I'll start with Billy.
Member of the board.
Then Chris.
I am Chris. I'm on the HPI board and currently unemployed on the youth services.
David.
All right, can you hear me?
Yes.
David Shad, I am the Chief Programs Officer at the Hope Center, and I'm also on the OHPI board.
Shannon.
Hi, I'm Shannon Derrick. I'm with Passport by Molina, and I work with our housing specialist here.
Diane.
Hi, I'm Diane Fleet with Greenhouse 17 and chair of the HPI board.
Jeff.
I'm Jeff Herron, manager of LFUCG's Office of Homelessness Prevention and Intervention.
Jenny.
Hi, I'm Jenny Zamora, Executive Director of New Life Day Center. Go on then. Hello.
Kimberly.
Kim Webb, I'm with Lexington Housing Authority. I'm Supportive Services Coordinator here.
Kitty.
Sorry. Kitty Collins. I am with Mountain Comprehensive Care, Program Manager for the Homeless Veterans Reintegration Program, and also Compliance Analyst for the Housing.
Marissa.
I'm Marissa Webb. I'm the Continuum of Care Coordinator within the Office of Homelessness Prevention and Intervention.
Marty.
Marty Jones. I'm with Community Action Council.
Nancy.
Yeah, I'm Nancy with Housing Advocacy.
Leonard.
Slaughter, housing specialist with Passport by Molina Health Care.
Lela.
Hi, this is Lela Still, Director of Behavioral Health for Behavioral Health Social Work for UK Healthcare and member of the board.
Christy.
Hi, I'm Christy Shuffett, the Executive Director at New Beginnings Bluegrass.
Okay, I think I got everyone. If I missed someone, go ahead and unmute and introduce yourself. Okay, hearing no one. The next item on our agenda is the approval of the meeting minutes from the December 11th, 2024 meeting. Does anyone have any corrections or edits? Okay, not hearing any, so I will accept a motion to approve.
As a
Someone will
committee,
have
this
to-
is a full membership vote. It can come from anyone.
I will make that motion. This is Diane.
Thank you, Diane. And I need a second.
I'll second that motion.
And just as a reminder for votes, to be counted in the vote officially, you do have to have your camera on for official committee meetings. So if you're going to take part in the vote, please turn your camera on. And then all in favor, you can unmute or wave at us.
Aye.
Any opposed? I don't hear any, but I also don't see any. So, that motion is approved without dissent. We have, we have three program reviews for today. The first one is our Community Action Council Emergency Family Housing with the Extended Social Resource Grant Program. Marty, are you presenting for us today for this program?
Yeah, I'll be presenting.
Okay, I will turn it over to you. You have 10 minutes to present, and then we have time for questions from the group and discussion from the group.
Okay. Hello, everyone. Hope everybody's staying warm today. So this is discussing our emergency family housing program. I think it's been in existence now for about 10 years. So it's around 2014 or 2015 or so when it began. And it is a sort of a non-traditional shelter model. So we utilize scattered site units as well as hotel rooms to provide emergency shelter or crisis housing for families who cannot go to other shelters, either without separating or for other reasons. And we use the definition of family is provided by HUD's equal access rules. So that, sometimes that will include, families with children. It may include multi-generational families. It may include same-sex couples. It's just basically how they define themselves as families. So just like, other housing programs, obviously the goal is always to obtain housing and in their experience with homelessness as quickly as possible. And as I said, we do prioritize families with children. And then we also, for this time period, was for the program year from July 1st, 23 to June 30th, 24. And during that time period, we did provide some additional shelter for families through additional funding through the Office of Homelessness in the effort to expand shelter capacity during the winter. And so for those rooms, those were focused specifically on families with children. And the best that I could, I tried to sort of break the numbers down between, at least the total numbers down between what was included with our normal ESR funding and those within the winter shelter. Some of the other numbers were a little more difficult to kind of separate, but at least for the total numbers served, it was a little easier to break those down. And so our target with our ESR application was 81 persons served in 27 households. In actuality, we served 120 persons in 35 households. You'll see in parentheses that 72 of the individuals and 20 of the households were served during or through the winter expansion. As far as the breakdown, we did serve, say, join more females than males. The age breakdown. So I would say, was that 44? Over, I guess, close to 60 of the total persons served, about half were under the age of 18. And then, the rest being mainly between the ages of 18 and 64. There were, a few elderly as well. The numbers were, close about even if you're looking at ethnicity, when you look at, as far as those that were white or Caucasian and those that were Black or African American, with there were a few Hispanic as well as multiracial within the demographics of those that were served. And then of those 27 individuals had reported physical or mental health conditions were recorded at the time of entry. As far as the performance measures go, our goal is to try to, limit the amount of time that they stay in the shelter. Sometimes that's more, that's easier to do with some families than it is with others. But the target is always 30 days. So there was a couple different ways to look at that. So with the mean, we were right at 90 days, which I think, over the time period of the project, I think we've been pretty close to that, although we'd like it to be shorter. We still think, 90 days is not an extremely long time as far as shelter goes in terms of trying to find permanent housing while they're there, not as quickly as they like, but there's also just depending on outliers and others that kind of pull those numbers up or down. So that's why I included the median number, which is 34 days, to also kind of give an indication of the amount of time that families are staying in the shelter. As far as those exiting to permanent housing, the target is 85%. We were at 65%. So of the households that were in the project, 32 of those exited the program. 21 did so to positive housing destinations, which means that they exited to either to they may be an apartment of their own. It could have been that they exited to stay with family or friends on a permanent basis. There was some kind of an arrangement there that would be by positive housing. It means that it was a permanent situation. We'd also, just because the time frame with the winter shelter, that we weren't able to house everybody that we had provided shelter for within that time frame. So there were 7 households that did exit the shelter or a temporary destination, which we would see as more positive than if they were to exit to a homeless situation. In terms of income, this has always been a tough one just because of the amount of time that they are in the program. It is a shorter time period. So the actual ones that gained or obtained employment while in the project was 6%, but the 54% had income at the time of exit. So it's not like there was only 6% who had income. That number was larger as far as those that had income at exit. It's just that they only count toward that outcome if they gain or increase while they're in the project. And as far as some of the other, I think these are some of the local priorities as far as case management. Every family that enters the shelter receives case management, and we didn't have any exits from the project for any kind of rules violations. And then just as far as our ongoing evaluation and improvement for the program, we periodically review our outcomes and measures to see where we're at and take a look at where we may be as far as average length of stay, how we're doing as far as exits to permanent housing, and income and employment as well. With exits to housing and length of stay being probably the two ones that we focus on the most. Then an update as far as the DEI is related. We no longer have the Office for Diversity, Equity, and Inclusion. That was due to some budgetary cuts that we had to make with funding. But however, some of those efforts are continuing. Continuing as far as ensuring culturally informed policies and promoting and educating CAC staff on related topics and related topics. And we are, I guess, just in terms of some of the more recent developments with the new administration, sort of awaiting guidance or have received, a little bit of guidance, but also kind of awaiting to see how that's going to play out as far as, materials and things that we have related to communications around DEI. So that's kind of obviously a big topic at this point. And then I will add that we did just are currently conducting our 2025 community needs assessment. So that's how we gain input from our stakeholders that kind of helps guide some of our priorities and policies and programs and things. And so we did this year include questions specifically related to housing and homelessness. And so we will use that information to sort of guide some of our direction over this year and over the next several years. But that's pretty much all I had for EFH.
Thank you, Marty. I will open it up for questions and comments from the group. You can just go ahead and unmute to ask a question or make a comment.
I don't know that I have a question. I just sort of want to applaud that you didn't have any exits due to rule violations. So as a shelter person, that just means to me that you must be, really kind of working with folks of doing really solid case management and advocacy with them, because I know people are coming in a really stressful time. And so it's easy for some programs to be much more infraction oriented. So I just thought that was a really impressive statement.
We tend not to or try to work with our families as much as possible. I would say that's not. I mean, it's hard to go through a year without having any. I think sometimes it's just the way circumstances fell. But yeah, we do try to try to work with the families as much as possible, so that exiting them from the project for rules violations is sort of a last resort.
That's
I had to ask.
definitely a plus.
Does that 0% removals include those that were in the winter expansion?
As far as I had to look back, and I couldn't remember any that we had to remove from shelter. When I looked back at my notes and the things, that was almost a year ago, so I couldn't find any from any notes or anything that we had exited anybody for rules violations. But that was just based on the information and the notes that I had on record.
As somebody that's intimately familiar with working with folks at motel right now, I know that it can be a challenge to say that you have nobody removed from hotel.
Well, I can't say the same this year because I know it's happened. But we had a smaller number last year too with the hotels. I think we ended up with only 20 families through the hotels, and we almost have 20 families in the hotels right now. So it's been a little busier this winter.
My other item is really kind of just more of a discussion point for us all to kind of be keeping in mind. I know Marty touched a little bit on things like the current administration. And he also mentioned the struggles that we have with income growth measures. One thing that I just think that we should be anticipating is the last time that we were under a Trump administration, over the course of several COC NOFOs, we saw some walking back of housing first policies, and we saw a lot more requirement to work language kind of creep into those NOFOs. I definitely think that we should be cognizant as a continuum that we are likely going to see some areas like that in the future, where we might need to be proactively developing some system strategies to help in certain performance areas, to help people get connected with things like employment, because I'm not really sure exactly what resources that we're going to have and what kinds of expectations that we're going to have placed upon what funding is available to us. So just something for us to keep in mind.
Anyone else? Okay, thank you, Marty. Our next presentation, we have two from the Housing Authority. The first is the Shelter Plus Care Permanent Supportive Housing Program. Who will be presenting on that? Is that Kimberly?
Can you hear me?
Yes.
Okay, perfect. I set out when Tanya asked me to do this, I was like, oh my gosh, I'm a nervous wreck. But after about 15 years in this field, you get it, you just question yourself at times. But our supportive housing program, we did collaborate with Natalie's sisters. We have 10 people that can be in. We only have 8 presently in our program. This has been, I heard someone say, having case managers, and it works with working with those clients. It helps ever so much. And I have watched case managers not be on the ground when these people are put in housing, and it's like an epic fail. So I'm grateful that we're starting to see supportive services wrapped around the housing they receive. 1 minute, bear with me. I made sheet notes. Okay, well, we'll go into, I've had really a good success rate on working with these clients. They have been open to services that have been offered to them, which is huge. And I'm hoping that continues. Does anybody have any questions? As I say, I'm new to all this speaking. I don't enjoy it, but I'll answer any questions that I possibly can.
So I think one area that I definitely would have a little bit of concern or question would be around the income measures. I see that we have 0% on all of those. Knowing how HMIS polls those measures, what this tells me is that it could be one of two things. It could be a reflection of none of those clients actually achieving income growth, either earned or unearned, or it could be that we're not necessarily having those updates put into HMIS. For example, for stayers, this is going to read off of their annual assessment. For leavers, it would read off of their exit. Do you think that this is a true reflection of the performance of the project, or do you think this is more of a reflection of a data collection and entry challenge that we're having?
That would be the ball lands in my side of the court with that. I had a pin removed from my toe. So the last few months have not been, last couple of months have been not so good. But I talked to Tanya, I think it was Friday, and I'm going back in and making sure all the assessments are up to date.
Okay.
Because
that would be helpful for us to try to get done as soon as we're able. Our community is working on our system performance measures as a COC funded project. This would be included in those measures. Definitely reach out to Adam on my team or Marissa if you need any help with those. We don't yet have a deadline for when we're going to be actually submitting all of that yet, but we do anticipate that it will be sometime here soon. So we definitely want to see you guys get credit for any good work that you're doing.
Absolutely, because I know there are quite a few that do need income increases done, interims done. So we will take care. I shall say I'll take care of that.
Any other questions or comments for this specific program? Okay, I don't see anyone chiming in. We also have I believe the program that you were just describing was the supportive housing grant program.
Right.
So then we also have the Shelter Plus Care permanent supportive housing program.
Okay, and that specific program serves chronically homeless families and individuals up to 30 families. This is just, I just started working with this program. right now, and I got to look at the data. If you'll hold on just a minute for me. Let's see. Target and program 30 days. Mean is 90 and median is 34. Bear with me. It's all right here. I apologize for. Yeah, but I just started working with this program also, so providing supportive services for them. And this is my type of work I enjoy the most, is working with the client and watching them achieve, adapt, and overcome. Here we go. Okay, here we go. Target number of persons served, target's 30, actual is 45. A number of household serves, target's 30, amount 43. Length of stay is typically 2 to 3 months. And I think I've given you all the data on that, but I will be going back in that program too, hopefully getting everything up to date in HMIS. That is my goal. I do not like errors in HMIS at all. So if it's a puzzle I have to fix, that's what I'll do.
Could you talk a little bit about on the performance measures? It says length of stay, and you talked about 2 to 3 months. So it says the target is 60 days, but your outcome is 150 days, which is a little bit longer. So could you talk about some of the challenges there, or what you've been experiencing, and or why that was longer?
That's just it. I just took on this caseload. I'm not familiar with them. I've worked with like 2 of the clients out of the COC. I'm just kind of getting my feet wet. So I really couldn't give an accurate answer to that question. I apologize.
Okay, thank you.
You're
Any
welcome.
other questions or comments for this program?
Well, I had a question, I guess, about moving on to permanent housing, but I don't know that it makes sense to ask the question because I know I'm listening to you, I know you're so new to this actually, and then some of it might be data. But that would have been my question. I wonder if once it gets back in, if we can just kind of circle back around, even if it's not a formal presentation, just sort of hear a little bit of where we really are at, I guess.
Absolutely.
Thanks.
Any other comments or questions for this program? Okay, thank you, Kimberly.
Thank you,
And
Marissa.
Diane, if you have specific questions, maybe we could give those to Marissa and Jeff, and we could get more detailed information for the programs later, considering that we might need to come back to this.
Yeah, I definitely think
that
that
sounds
we
great.
should have some follow-up for LHA.
Thank you. And then for New Life Day Center, we have the day shelter for the Extended Social Resource Grant program.
Yes.
Is that Jenny?
Yes. And I think that the data that I gave was when we were still under the HPI grant, which was for 9 months prior to that. So our numbers will be probably very similar but our goals are going to be a little bit different, I believe, going forward. But I'll talk about a little bit about us and the goals that we have for that 9-month period. My name is Jenny Zamora. I'm the executive director of New Life Day Center. I've been here about 2.5 years. We are a faith-based emergency shelter that's a day center. Days like today, when some partners are not able to open due to staffing and weather, we are still open. We try to be open as much as humanly possible in inclement weather. I don't think we've had to close due to weather since I've been here. Sometimes we have a skeleton crew, but we still try to make it work. Today, when I came in, we had several clients outside waiting to come in who had spent the night outside, even though yesterday when we left, the people who left here yesterday, we worked on making sure they had places to stay. So because of that, I think we serve some really vital needs here in the community. Our main demographic, we serve about 75% of male adults, 25% of our clients are female adults, mostly ages 25 and up. Anyone younger than that, we usually refer to services that better meet the needs of young adults. Our part of our main demographic too is typically chronically homeless, active, mental health disorders or substance use disorder. Most of our clients, the natural first step in housing would be entering some type of rehab program or sober living or that type thing. So we put a really heavy emphasis on that. Did you have a question, Liz? I was looking. Okay. A lot of our services that we provide, there's about 20 services that we try to hit and that we provide on a regular basis. Our highest need from people is breakfast. Our closest partner is Lighthouse Ministries. They always serve lunch and dinner, and many of our clients overlap, but they will likely never serve breakfast. And this is the place in our neighborhood that clients go to for that. Our goal is to serve as a connection point. Transportation is a barrier for most of our clients, so we try to bring as many services as possible on site for them. Zoom calls with Social Security, SNAP, and insurance benefits can be applied for directly on site. We have client phones. We offer some unique things that not all day centers offer for people. We have locker storage, over 130 lockers that are assigned to clients that they can have to store their personal belongings in it, so that they don't have to take everything with them to appointments. We offer using New Life Day Center as a mailing address. And for the last almost year, we have outdoor porta potties that are accessible 24/7. There aren't a lot of places after hours where our clients can go if they are unhoused to use the restroom at nighttime. And it's some of those dignity things we care a lot about trying to provide for clients. We have a regular rotation of various sober livings, rehab facilities. They come on site and set up tables with information and chat with our clients about taking next steps for exiting homelessness, because that's a lot of the next steps that need to happen for our clients. It's directly related to that. That's some of our services and a lot of our demographics in a nutshell. That's who we serve and how we serve some of our clients. The performance measures that we have, because we are not an overnight shelter and we offer day center services, a lot of our targets that we set out to meet are daily ones that have to do with basic needs: breakfast served, toiletries, personal hygiene items given out. New Life Day Center temporary IDs, we print those out, and a lot of the local community service places and most health clinics provide services based on using our New Life Day Center temporary IDs. I'm not going to read those numbers off for you. A couple other things. We have a co-located clinic here on site with us, and most of our clients can get access to the health services that they need same day, and most of them consider that their healthcare home. So that's a vital part of our services too. And in that 9-month period, we made almost 1,000 referrals to the clinic downstairs. where clients were seen. So that's a big deal for a population that often doesn't get regular health care. Another unique thing that we offer in a partnership program with the city's environmental services, we have a panhandling diversion program where we offer employment to people who are on the streets panhandling. They can come and help pick up the city. We can take 11 people out a day, and just during that 9-month period, we were able to pay and divert people from panhandling over 1,000 people, or over 1,000 shifts during that time on the runs. So it was 122 runs with over 1,000 people. So that we're really proud of helping with that, because it helps our clients and it helps the city. I don't want to read point for point our statistics. We did do a recent client survey. We usually do that at the beginning of the year, and I feel like we got some good data that I had after this report from our 50 responded to it. Of the 20-ish services that we provide daily, they ranked them. The top service need that they had was breakfast, followed by bathrooms, and after that, lockers. They would like to see us add, different services such as bus passes and transportation. We ask them the furthest place that they are able to frequent on foot, or that they regularly frequent service wise. And the top two answers were Lexington Rescue Mission at Glen Arvin and Hope Center. And out of our survey recipients, which were 50, we asked, are you homeless? 75% said yes. Another piece of data we gathered, are you covered by Medicaid? And 80% of them said yes. So these are some other measures that we weren't able to include in the measures that I put on here. But right now we've switched from the HPI funding to the ESR funding. As part of this, we're receiving funding, and we're actively recruiting for a case manager. And that person's going to be our primary person responsible for entry of our data into the HMIS system. And I'm really excited for that to be coming on board very soon. We are working on different changes to our facility as well. We're going to have a new check-in station, and that's going to help with some of our safety and security issues that we've had. And I think that's all. Does anyone have any questions?
So first of all, I just want to commend you all on the efforts, especially I've seen it this season as we've entered a winter with several stretches of inclement weather. Thank you for the dedication to making an essential service available, despite what the weather may be doing. Very, very much greatly appreciate that. There's been several times where we've had some kind of a need. I know this morning I talked to a neighborhood resource officer. We were trying to facilitate entry into our winter shelter program for somebody not eligible to stay at shelter. They were able to go to New Life and have somewhere warm and safe to be until we could get them placed. And those are the kinds of things that is able to facilitate for us. So much appreciated. The other thing I think I would just bring up as a question for you in terms of a lot of the contexts, and even though panhandling and homelessness are not necessarily one and the same, they can overlap. I do get a lot of feedback, we'll call it, from the community about the level of panhandling. Would New Life Days ever have an interest and or capacity for potential expansion of that program if resources were there?
We actually have expanded some in this past year, and we are open to expanding further. Part of the conversation that we had with the department in the city that we work with was, I want to say, very early last year, probably about a year ago, and we expanded from doing 3 half days a week to 5, and they were 5-hour paid days for the workers, to 5 7-hour days. So we have expanded. From what we used to do. It's a lot more shifts that we're able to do. All of it is weather permitting. They have thresholds where the van doesn't go out if it's over a certain extreme heat or under, I think it's 34 degrees, because it's obviously not humane. to work under those conditions, but we have expanded some. One of the questions that we were asked is, is there a possibility in the future of maybe running a second van? And, we would be open to that. I think finding a unique fit as far as the driver who really is able to efficiently navigate, different things as far as that role goes with the personalities of our clients that we help, and working with the city in an efficient way on the routes. I think, that's sometimes a tall order. We love our van driver right now, and he does an excellent job. I would like to find a duplicate of him at just the right time, for when the city does find funds. But I think we definitely are open to that, and we indicated that in the meeting.
Right. Just for you or for anybody else on the call, there is a request for proposals open right now for project funding under $40,000. That is our professional services limit, and where not everybody is necessarily being asked to write for the same specific service. This gives some flexibility for you to potentially write for some funding that could support your agency's ability to increase or expand services in new and innovative ways. I know we've had a lot of conversations about capacity building, and I just think that was a very natural way for us to make sure that you're aware of that opportunity. The RFP closes on February 28th.
Okay, thank you for that.
And Jenny, I'm not sure if you saw in the chat, but Chris asked if you could share your contact information.
Yes, I'm working on that right now. Yes, ma'am.
Any other questions or comments for this program?
I don't. I just love the practicality of it all. I mean, I know it's really, really hard work, but so many times, we think of larger things. And I love when you were talking about things that bring dignity to people. I love that you have bathrooms that are available to folks. I love that people can get out of extreme heat or extreme cold. And I know when we've had some conversations on this board about flex funds, these are things that people talk about. I need a locker, I need these things. So I love the work you're doing. It's great.
We've tried to fill, lockers are one of the highest requested needs in our facility. We have jammed 139 of them in here. It used to be 132, but we reworked some space and got 7 more donated, and they were given out within a day. So we're at max capacity with lockers. I wish we could do more, but it's a huge, huge need for our clients.
Yeah. Yeah.
I would like to follow up on that. It did say in your documents that you had a waiting list for the lockers. How big is your waiting list?
Usually it runs about 20 clients at any given time, because once someone does make it up the list and get to a locker, are basically the 2 requirements for keeping the locker are check in with us, once every 30 days. If they're not utilizing our services at least that frequently, then it's not a storage unit. We want it for active clients who are trying to utilize our services and really need to be at and around this location as a home base. So that's part of it, and just staying on, good behavior with the rules of our facility. Those are the 2 requirements. And beyond that, once they get a locker, until they really have moved on, and it's always a happy thing. I've had in the last few months, I've probably had 2 clients come to me and say, hey, I'm really willing to give up my locker because I've been in a stable place long enough that I know how vital it was for me. I want to give it to someone else, and that's important. So.
That's amazing. Thank you. Any other questions or comments for this program?
Jenny, I'm curious how large those lockers are. Are people storing primarily paperwork and important documents, or is it kind of something larger?
So it's larger than that. If you imagine like high school lockers, if you went to high school in the 90s like I did, which reveals my age, it's like a full-size high school locker for many of them. Probably I would say half, or well, I guess that would be a third. The other 2/3 are like half of that size. There's an upper one and a lower one. So, and I think there's kind of a ranking that our center coordinator usually uses, because the bigger ones that store more are more coveted than some of the other ones. And so they get shifted around a little bit when we have lockers emptied and there's a pecking order, and I'm glad I don't oversee that part of the process, honestly.
Thanks.
Any other questions or comments?
Just thinking creatively, if you were to stay, I know you all rent your current space, if you were to stay where you presently are for a significant duration, would there be any opportunities to put more lockers like outdoors, like around the building, perhaps like back where the shade structure is, anything like that?
You know, I don't think that we've discussed that. I'm not sure how waterproof they would be. Probably fairly waterproof under the shelter. But we haven't looked into that, and I don't think it's a bad idea. I would be concerned, I don't mean waterproof, but the moisture level for
Right.
what might happen outside. But
Yeah,
I mean,
definitely thought about the fact that the weather would make it a little bit different than if they're indoor.
right, yes. But there are a couple nooks and crannies here that if we really wanted to get creative, we probably could fit a few more, and we've discussed it, but we'd have to get, you know, just the right size lockers to fit in between windows, that sort of thing. So, but we're always trying to look at that, and we had to shift some things around to get the 7 more that we got. So if we stay here, you know, longer term, I'm sure we will add as many lockers as without double stacking them as we can fit. So, but I think we could look into that though, Jeff. That might be something that is a good creative idea to look into for sure.
Any other questions or comments? I don't see anyone unmuting, so thank you, Jenny.
Thank you.
The next thing on our agenda is open time for other public comments for the group. If you have any, you can go ahead and unmute. Okay, I don't see anyone chiming in. Our next meeting is April 16th at 1:30 at the Don Ball Campus Center, 298 West Loudon Avenue. On the agenda for that meeting are 2 presentations from Community Action Council, so the Crisis and Housing Support for Youth Rapid Rehousing Program and Project Independence Rapid Rehousing Program. We also have the Emergency Shelter for Greenhouse 17 on that agenda and the New Vista Permanent Supportive Housing Program. So if there aren't any other announcements for the group, I will call us adjourned since we are at the end of our agenda. Thank you, everyone.
Thank you.
Thank you.
Thank you.
Oh, that's a funny little picture with like the seats. Is that on your screen with this, like all the faces in the seats? Do you see that? I've never seen that before. That's funny. Okay, bye.